Now, what role does a project manager play in building this trust within AI healthcare projects?
Project managers are not just taskmaster. They should be framing an AI project as not just a technology deliverable, but as a human-centered change. It's integrating that technology with what I call humanizing the AI project.
Why is it so important that healthcare finds ways to adopt AI?
What is at stake ultimately is more than efficiency and effectiveness. This has a direct impact to patient care. If that adoption fails, there's a grave risk of patients and members may miss out on potential life-saving interventions. There may be misdiagnosis if the machine or the predictive modeling tool does not make sense, especially if AI models are trained on incomplete data. The marginalized population may even face worse health outcomes.
And that's why I think healthcare is so interesting, because it's that rigor by default. It has that many stakeholders with that many different perspectives by default. And so it's almost like one of the most complex versions of the game, implementing AI to create solutions that drive better outcomes for humans. Today, we are talking about the immense potential of AI in healthcare and what project leaders can do to build trust, raise risks, champion ethics, and ultimately drive patient outcomes through AI-powered healthcare projects. My guest today is David Doan, Director, Consult Partner for Healthcare and Government at Kyndryl. David is a healthcare technology and business transformation leader with over 30 years of clinical and consulting experience. He started his career at the bedside as a registered nurse for the first 10 years, and then went on to consult at McKesson, Accenture, Ernst & Young, and is now partnering with C-level and IT executive clients to drive strategic digital transformation, AI innovation, and value-based care initiatives at Kyndryl. Beyond that, David is the president of PMI Los Angeles chapter, serves on the board of directors of 5 other nonprofit organizations, is a mentor for the Asian American Professional Association. So far, that's only half of his rap sheet of accolades and accomplishments. You're very impressive, David. Thank you for being on the show.
My pleasure, Galen. Absolutely.
I know we zig and zag, and as we were preparing for this, we covered a lot of ground. But for this episode, I'm hoping that we can just cover just the excitement and the fear surrounding AI-enhanced patient care and what can be done to address both. What's at stake for our healthcare industry if we don't get AI right? How a framework of trust can help project leaders align disparate stakeholder groups, and maybe just how project leaders with no previous healthcare experience can get into the healthcare space, and maybe vice versa. How does that sound to you?
That's wonderful. Great discussions, great questions. I have my work cut out, but I'm pretty sure I can provide a little bit of insight based on my experience. But yeah, great discussion.
We've got this tradition here where I kind of start with the big question, the one hot question that we can then sort of zoom out from and then build the context around. So my big question is this: what is the biggest fear that clinicians and medical practitioners have when it comes to AI being introduced into the way that they deliver care?
Yeah, great questions. Very relevant one. I summarized it in kind of 2 topics. One is the fear of losing human connection and judgment is one. So I touch on that. And the second is really the fear of accountability. So I actually started my nursing career writing charts, literally writing. There's no such thing as an electronic health record or electronic medical record. When we move into technology, even just giving medications out of this machine called Pixix machine, we always were fearful of how is that going to disconnect us with the patient somehow. And AI is definitely another example of advanced technology that can actually do that. So for example, now there's AI tool machines and predictive machines that can actually read the film from a chest x-ray or a PET scan. So there's a fear of not being able to actually, touch and feel and having that human connection, and also the judgment. As medicine, nursing, it is certainly a science, but there's a lot of art. And that requires a lot of data, clinical data, non-clinical data. And then the last piece of the puzzle in healthcare is really the clinical judgment. That's really what differentiates between a non-clinical staff versus a clinician that has, a license that they need to practice at the top of the license, but also a sense of accountability as well. So I think that the fear where AI can actually replace conversations and dialogues with patients at the bedside, or even when you're visiting a doctor visits, or even sometime when you have telehealth or telemedicine, is that they fear that they cannot and should not lose that really the clinical judgment and their decision making. So whatever technology or tool, that is one thing that we need to really address. It needs to be collaborative with the clinicians. So algorithm that spit out predictions, they need to make sure that the data is insightful at the point of care, but really appreciate the need for the clinician to understand and trust the data and the insight, but really preserve that sacred clinicians and patient relationships so that way they still are somehow providing the clinical judgments that help inform the decision making. Accountability piece is important too, because in medicine, clinicians are trained to do no harm. But we have an oath to do no harm, and we want to make sure that the AI or technology model actually works, and that when it makes recommendations, that it is consistent and aligned with evidence-based guidelines and all of the other reputable professional organizations' recommendations. That accountability really rests on, can clinicians still have that final review to make sure that they still ultimately accountable for it, but the AI system or the kind of the technology and the engineer around that, there has to be some due diligence to ensure that data is not false, to help ensure that trust as well.
I love that. And like I like that you framed it around the fact that it's like an art and a
Mm,
science,
mm,
right? Like giving care. And I think sometimes it's easy to get swept up from a very high level of, oh, it's just information. We can upload all of this knowledge, all of our medical knowledge, and then that information will be available. But I also like the other thing you did there. I don't know if you meant to do it, but there have been a lot of disruptive technological progressions in the healthcare industry. You mentioned some of the prescription apps. We're talking about telehealth. There's been a lot of things, and I think what I like about your answer there is that like these are the underpinnings that have helped us get through all of this change. And I know like EHR, like the electronic health records or electronic medical records, it's been a long
mhm,
journey, hasn't it? Right. At my time in consulting, we're still transitioning systems over. In some ways, it's not just technological progress. It's like we're still building trust, and we're still sort of being careful because of that oath, because we can't just assume that something that happens in the black box is going to work well every time, or 90% of the time. Like that isn't quite good enough. It's the judgment and it's the sort of humanity that needs to stay in it. And then also, like, I just think that idea of the consistency. You mentioned consistency, and immediately my head went, oh, yeah, hallucinations in AI. Like, it's fine in my work, right? It's like, wait, hold on. That was not the answer that I was looking for. Or even I asked it the same question 3 times and got 3 different answers. That's fine. I can fix that. But like, when it comes to patient care, like, that is something that we have to do very right and be very careful about. I wondered if maybe we could zoom out a little bit because we've been talking a little bit about accountability and trust, the patient experience, and the humanity of it. We talked a little bit along the way about sort of some technologies, and technology always does find its way into healthcare, and for good reasons. AI seems a little bit different in some ways, or maybe it's not. But I thought maybe I'd just kind of ask, like, why is it so important that healthcare finds ways to adopt AI? Like, what's at stake here, and what's like the biggest barrier that like AI adoption
mm.
faces in
Got
healthcare?
it. What is at stake ultimately is more than efficiency and effectiveness of how clinicians interact with their member or patient, or the healthcare delivery team, because there's a whole team that manage the patient, is ultimately really result to positive or health outcomes. Is such big ramification and consequences and consideration to think about, is not just making someone's workflow easier, having a better experience. Ultimately, this has a direct impact to patient care. And then that patient care, even though it's one on one with the practitioner at a time, it actually ultimately results in what I call on a massive scale called population health. And it also aligns with the quintuple aim, where it's not just about costs, it's not just about access, it's now about the clinician experience, the patient experience, and finally at the tip, which is the fifth kind of layer of this kind of triangle, is health equity. So where does AI come into that? AI can definitely certainly predict the diseases, taking in so much data, the clinical data, the claims data, the non-clinical data, the publicly available data, and so on. All of that helps to predict, which patient cohort or populations that the providers or the health plan or payer can identify quickly to intervene to kind of slow the progression of any disease state, chronic conditions. Now, if that adoption fail, what you can see is there are patients that should be managed and they're not, or they have been identified of having something that they're not appropriate. There's also an opportunity where there's a grave risk of patients and members may miss out on potential life-saving interventions. There may be misdiagnosis if the machine or the predictive modeling tool does not make sense. And when we think about technology, there's also a lot of people who don't live in large metropolitan cities. In rural populations where there's critically accessed hospitals, we are still being challenged with technology. The technology may be available, but the 5G connection, the network connection, the internet connection, how do we actually manage that? And when I talk about health equity, are you expecting someone who English may be not their first language, but they also are challenged because of dexterity, level of education, or age, and so on, to be able to use whatever telehealth medicine it is. So
Mhm.
AI, when you talk about AI, there's a huge implication, and what's at stake is ultimately the health outcomes of the population. The biggest barrier, I kind of alluded to it, is a lot of it is this technology barrier from the receiving or the receiver of care. That's your patient's
Mhm.
member. But if I were to focus on the clinicians and the care deliverer and also the caregivers, is that really that trust we talk about? But from a technology side, information needs to be interfaced or integrated and immersed into the workflow. So if it's not immersed in the workflow, AI may force the clinician to use another technology, or you have to have a little thing that to record the conversation. Where does that information go? Does it actually immerse or present it in what I call the natural workflow of the clinician? Because if it does not present itself in that workflow that is really seamless, it's not gonna increase the adoption of the usage of the whatever the technology is. Because anything that disrupts the clinician time with patients, that will result in poor adoption. Lastly, there are biases. So if AI models are trained on like incomplete, lack of data, or the data is not normalized, standardized, or skew in some way, therefore, those are the opportunity where patients could, especially the marginalized population, may even face worse health outcomes. So that's what's at stake is massive about health outcomes, and then also the adoption of clinicians with technology.
I'm really glad you went there, especially with the like patient and clinician experience. My background's in user-centered design, so like mostly we're like digital solutions that, yes, solve a problem, make something more efficient, leverage more data, but also fundamentally, yeah, have to be like workable, have to enter into a workflow seamlessly, so that it doesn't create an additional barrier. And you were saying up top, when you were a registered nurse, you're doing bedside care, you're writing these things by hand. There is an opportunity to take some of that time, really give some of that time back, right, to a medical practitioner so that they can focus on patient care. But at the same time, not adding like an additional step in there that might actually, lead to worse outcomes or, lead to more challenges in delivering care. And that health equity thing, I hadn't really thought of it in that way. I was chatting with someone last week. We were talking about how, AI is sort of kind of like levels the playing field in some areas, right? Where right now there's people who are vibe coding. They've never been developers before. They didn't train to be a developer, but now, they're able to create an application and vice versa, right? Technical folks who don't consider themselves well versed in like business language now can sort of use some of these tools available to them to sort of have those conversations and like break down some of the silos. I did a little bit of work in like outpatient care, telehealth sort of stuff in from a digital side. It really opened my eyes. I think what you said about folks living in metropolitan areas versus bulk of the population which doesn't. We're scattered about. The infrastructure is different. The United States in particular has been pretty, I guess, aggressive about getting broadband everywhere and the 5G transformation. We can't just assume that everyone has access to all these things, has the ability to engage with all these things, is open to all of these things. And I think that's the big zoom out why I think it's super interesting in the healthcare side of things, because unlike some of the things that, we talk about in the business world, where we're like, hey, we can get Copilot, to like be helping us write documents. We're all sort of a certain type of knowledge worker doing a certain type of job. Healthcare is not that. Healthcare is everybody. It impacts everybody. It goes across demographics. It goes across a lot of different things. And that's why I think it's such an interesting and juicy topic, because even if you're not in healthcare, if you're listening to this and you're not in healthcare, this at least shows that picture of AI at scale, right?
Absolutely.
And like with different members of the
Hmm.
population for something that really, really matters, which is, the health of our population, patient outcomes, and ultimately health. I did like also what you said about preventative. It kind of got me thinking, because predictive analytics, right? It's one of those things that a lot of businesses are like, yeah, they've been on it for years so that they can anticipate. And then I started thinking about things like, you have your health spending account to get like an ergonomic office chair, right? In some ways, that's preventative care, because it's like, okay, if you're not, sitting in a garbage chair all the time, then you're not likely to develop back pain, chronic back pain that then we need to treat in a certain way. And then I started thinking about strain on system, right? And I'm like, okay, well, there are like health administrators, healthcare leaders, and even just the business side of the
Right.
system going, wow, that's great. Yes, we want to prevent some of these things from getting too far. You said, intervention at the right
Mhm.
time to get people the care that they
Yep.
need. And I'm also like, well, some of the folks, don't get me wrong, noble in intention as well, but it's their job to also think about strain on system and like money, right? To be like, well, it gets a lot more expensive to treat people later in their, health journey. Whereas if we catch it early, that could be
That's
cheaper.
right.
But then it got me thinking, because you actually are someone who did a decade at
Mhm.
bedside as a registered
Mhm.
nurse before entering the consulting
Right.
world. Now you work with chief medical officers, you work with regulators, you work with other decision makers in the healthcare
Mhm.
space. But in other words, like you actually are someone who can see things from all the
Mhm.
perspectives. It got me thinking about like trust, but also how can trust around AI be built between patients and caregivers and clinicians and regulators and business leaders? They all look at it from a bit of a different
Right.
perspective. And like what's involved in reconciling all those
Yeah,
perspectives?
you are making me work very hard, but Galen, I'm delighted to share my perspective on the hard question. Just by you listing all of those names of what I call stakeholders. So in healthcare, it's never a
Mhm.
person, it's always what I call a healthcare ecosystem. And that ecosystem may be people that are likely invisible to the patients or the members. Like, for example, you mentioned about regulators. So there's accrediting bodies. There's also Centers for Medicare and Medicaid Services, or CMS, and it's the Center for Disease Control, etc. They want governance, and they want to make sure that ultimately the care that is being delivered, whether you use advanced technology or no technology, is actually, a quality and is safe. And you also have the patients who want reassurance that do my practitioners or doctors even know about the culture that I am raised up or the language that I speak,
Hmm.
because that has a lot to do with the type of food and nutrition that I have a preference on. Obviously, clinicians want to see evidence. They are trained to really review what we call peer review articles. It's not just word of mouth
Mhm.
that, oh, the CIO or the chief digital officer or data officer said that we need to adopt ambient, listening AI. That's great. But what's the evidence as far as has there been done any research that shows actually there is a high probability that is correct versus how do we address some of the hallucinations we'll be talking about AI or just really misdiagnosis. So that's reassurance. Like, I don't want to be the first hospital to do this or the first health plan to do this. Has there been any evidence? When we say evidence, it's not just a blog, it's peer review articles. And that takes time to really build that literature up. And then you also have business leader, I hate to say it, is really about financial performance. Even in the hospital setting, it is a business, so they want to see hard quantifiable ROI with these very expensive advanced technology. So let me just give you some suggestions of how to bridge that gap to ensure transparency and having that shared language to really build trust. Because we talk about, yeah, those are the problems, those are the background that we have to work off of. One is what I call explainability. How do you actually have the data to really think about, in plain language, make the connection from a technologist, from an engineer, from a data scientist, from a product manager, talk to a clinician to say they understand the business problems and also the opportunities, meaning the specific use cases that AI can be applied. Can you explain how it will help? Can you explain how AI works with XYZ data? If they understand it, you're going to be able to get buy-in, but also allow that what I call the collaboration to have the clinician or the business leaders to ask questions because they are so busy. They don't know the details behind the technology. You have to talk about safeguard with information, with data. We have to talk about the connectivity of multiple data, how it gets presented into the workflow at what I call the point of care. So that whole being able to explain that in lay language or plain language from both sides, because the clinicians may be presenting a very specific use case that the technologists may not understand fully what that is. The second is really inclusion in design. You mentioned that you have background user interface, user experience. You have to have the voice of the customers. So who are these customers? The patients, the nurses, the practitioner, but also could be physical therapists, the pharmacists, everyone and everyone else. You need to really consider how, just because you're a clinician, a pharmacist's workflow, as you may already know, is very different than a nurse, than a physician's, etc. So those are the things to be considered. The modules within an EHR is configured differently for different floor and different unit, be as inclusive in the design, in the implementation, in the change management. And then it needs to really, really be couched around governance. People are rushed into implementing AI without solid policies, without the framework, without the governance structure. I know everyone talk about framework, everyone has a framework in every single consulting firm, but we need to carry that out. What are some of the safeguard or the guardrails around equity, fairness, bias, privacy, accountability that we need to address? I know that's kind of boring stuff, but without that, you will not be successful in rolling out and the adoptions will not be there. And also there's risk on kind of the regulatory side. And lastly is the cultural storytelling. What is this all about? It seems like it doesn't fit, does it? So how does AI improve not just the numbers, the quantifiable ROI, but actually patient lives? Let me give an example. Those clients that I am able to have the privilege of working, who I think got it right, is that they actually tell the technology team that whatever you're building or the requirements that you're writing and that you are testing, if you don't understand how this is used by clinician X or business user X and how that ultimately map to the positive experience and health outcome of the patients, then they should have no business working on this project. Isn't that brilliant? Is like the technology team should be an extension of the clinicians or the caregiver. So they should be actually caregivers of the caregivers. So that is when I think trust is built. So without that trust through technology, you don't have really the people, the process in place and buy-in. So I think storytelling is about the voice of the customer through conversation, to collaboration that yield buy-in, and that will help with transparency, and therefore trust will be enabled.
I love how that you paint it out as an ecosystem. I think a lot of people understand it as an ecosystem with a lot of stakeholders in it that, for a cause that really matters, right? People's health and livelihood. But I love that notion of even like the product team, the tech team, being the caregivers of the caregivers. And it's all actually it's one picture that different stakeholders have to look at it from different lenses, from different angles. Your chief medical officer or, there's a sort of business lens on things they have to care about money because guess how patient care is delivered, right? It requires funding. It requires money. And also it is something that is very regulated, right? We have these things in place. And it's funny, I like sort of drawing the comparison to, for example, the business world and you and I, we both come from the consulting world, so I think we can say this. But it's every other week that BCG, McKinsey, Accenture, EY, they're publishing a report. Everyone's sharing it on social media or via email. We're going, oh, that's a good idea. Let's start doing that right away. Versus like, has it been in a peer-reviewed journal, right? You mentioned things like, ambient AI listening, right? And then I'm like, I haven't been very close to a sort of medical journal recently, but like, what an interesting sort of way to sort of vet out these ideas at like the highest rigor of very smart people who understand the technology and the health implications and the human implications, being critical of one another to sort of make sure that this is the right thing, not just a thing we can try. It's a completely different picture than how a lot of people think about AI. And even folks listening, and maybe a bit of like part of me is like, well, shouldn't it be easy? Just try and roll out a little pilot program and then scale from there. Like, be iterative. Isn't that what we always do? No, unfortunately, the CDC also has to be on
That's
board. So you
right.
kind of have to have, it's a whole different thing. But I do also think that everyone can take a page out of this book, right? It's almost this like macro view of where we're heading. We started out with AI in the sort of business world in less regulated areas, just like trying stuff. And then we're going to run into that governance wall, right? We're going to run into the data quality wall. We're going to run into all these things that sound boring to us now, but are going to matter for everyone pretty soon. And that's why I think healthcare is so interesting, because it's that rigor by default. And it has that many stakeholders with that many different perspectives by default. And so it's almost like one of the most complex versions of the game of implementing AI to create solutions that drive better outcomes for humans.
You got it.
It's really interesting. I love that sort of framework. I wonder if I can bring it back to the sort of the project level as well. I recognize, I don't know, you and I were passionate about this thing, this sort of stuff. Like we can talk at a very high level. But I guess this is a digital project manager podcast. We've been talking about trust. And I kind of frame this around, AI powered or AI related healthcare projects, whether that's implementing AI technology or using it in the
Hmm.
project. But it still comes back down to trust. It's quite a complex
Hmm.
picture. But like, what role do project leaders play in building that trust? Like, is there a responsibility for folks who are delivering some of these projects? And just like you said about the technologists being the caregivers for the caregivers, what role does a project manager play in building this trust within AI
Yeah.
healthcare projects?
Well, this is a question that I'm passionate about just because of our kind of connection with project management in general. So I definitely wanted to, highlight some of the PMI concept and methodology here in the framework as well. But as far as the role of project managers in building trust, project managers strategically has this being able to orchestrate all of the stakeholders and all the project team members. So they are at a very privileged critical role of being able to see from all sides and all aspects. So I would say project leaders need to first of all be strategic, but also be able to make the translation. So that way the clinical, the business, and all of the stakeholders kind of understand one another, because that is really important that we speak, quote, the same language. Or I would say not just speak, but really to understand each other kind of needs and intentions and requirements and all of that. And then by being kind of this position of quarterbacking, you want to be able to then freely and proactively raise risk early and transparently, and think of framing an AI project as not just a technology deliverable, but it's a human-centered change.
Mm.
It's integrating that technology with
Yes.
what I call humanizing the AI project, where we are reminding project team members that is ultimately for healthcare, anyway, I'm speaking from a healthcare industry perspective, is that whatever is being introduced that is ultimately going to hopefully increase productivity, that yield more of what I call face time with the patients or members.
Hmm.
And then that somehow will result in kind of a positive health outcomes. I think it's all about health outcomes. That could be a whole topic of discussion, is how to even measure health outcomes and what are the vehicles and the data that will be needed. So back to project management,
Hmm.
I have been an advocate of project managers are not just taskmaster, and we're not here to just tell people when to do things and how to do things and all that, because you can have a robot doing that. I think project managers are not being
Mm.
tapped into the visionary, strategic, problem critical thinking skills. Let me give an example. I'm going to reference our president of PMI, Pierre Lamang, and he and his team introduced a concept called PMI Next. And that was probably about 2 years ago. And I think chapters and project leaders are still trying to understand what that is. So to me, how I interpret that is really the vision of what PMI or project management in general. So what is that vision? So we tend to say that the vision is really about the purpose of what it is that we are doing to elevate the project success that enables some sort of transformative change in the world. It needs to rely on strategy, being able to not just deliver the value tools, but enable continuous learning. There's also kind of the culture, values, and then the framework that helps support that vision or executing that vision is what PMI call it MORE, is an acronym, MORE, which is really maximizing that success through not just traditional metrics. We are very familiar with what I call scope, budget, and schedule. But what is really the
Mhm.
outcome or the positive impact in healthcare that would be positive health outcomes? Like the actual, are we actually saving lives? Are we actually increasing the longevity of how patients live, not just in number of years, but the quality of their, experiences and how they live? Are they actually changing behavior? Those are positive health outcomes. How do we organize the impact by empowering our professionals to really build a stronger community? And how do we reinvent and re-engage the ecosystem of stakeholders? So all these things are so important as what the role of a project leaders or managers have in any project, but particularly in healthcare, enabling advanced technology, AI is really adopting that kind of mindset of PMI Next and PMI More. That is the role, a very important role of a strategic project manager has in leading projects, technology project in healthcare.
I love the tie-in with being the translator, the translating quarterback, and how it ties into like your explainability, right? Like there's a very human element there. Even just the fact that you said that like these are projects that are about humans, like we need to actually humanize technology projects. It's the manifestation of what everyone, all those like memes or very inspiring graphics on my LinkedIn feed that are like, be more strategic, let AI elevate you into a more human role, yada yada yada. But actually this is like more than just words. This is like, actually, okay, this is how it looks like. And especially in the healthcare space where it is about patient outcomes and actual impacts to livelihood. I guess the devil's advocate in me, because I think you touched on it earlier, right? You're like, there's still people wrapping their heads around this. It's been a couple of years. These frameworks are relatively new in the grand scheme of project management, but also I think they're difficult because I think the critics would say, well, Pierre's just trying to turn every project manager into like a strategic C-suite
Mm,
executive. And yet there's this big
I
gap,
see.
right? Between learning how to manage scope, schedule, and budget and understanding your industry and the people within it so well that you can influence outcomes. It almost seems like a unfathomable leap, but of course it's possible because I do see people do it every day. I'm like, what do you think that leap looks like for folks? Like if you've been leading projects in the healthcare space, but you've had the luxury of being like, I just make sure things get done, but I don't really have to engage with outcomes. How can they then suddenly start, maybe not suddenly, how can they begin their journey towards the more framework where they can think about
Yeah.
outcomes, where they can think about, maximizing the impact of their
Yeah,
projects?
that's a great question. I think I'll ask like a maturity model or curve. So, for
Hmm.
example, if someone who just graduated from the university, whether they have an MBA or not, and they want to do project management, if we wanted to focus on the project manager role, first of all, they need to actually know how to project manage or manage a project. What is the
Hmm.
methodology, whether you're leaning on PMI or you're leaning on Agile or Scrum, there's so many variation of that. So then it takes a few years, I think, to really understand the mechanics and the methodology of it. Once you master that, I think project managers are going to get to a point where they feel like they can do it in their sleep. Well, that's always, as we know,
Hmm.
a trigger or a flag or an alert that you need to be challenged and you're not probably, learning. So what we wanted to do is project manager 1, 2, 3, or what we call project coordinator, become
Hmm.
project manager to become program
Hmm.
manager, portfolio manager. So there is an evolution for those who aspire to really think broadly about the impact of how effective projects being done will not just save costs and being efficient about it, but also when you get a product or a service out sooner, the end users will take advantage of that and outcomes will be realized. And then we also need to really, I think, take credit for the things that we do so well in project management, because we need to speak the language of what's the ROI from many different lens, not just the quantitative, dollar investment and dollar save and reduction in readmissions or reduction in or increase in revenue because we get incentivized for doing something great in healthcare. But how is that actually going to make a difference in a population or a community or a marginalized population? I think that's a call to action for project manager to have a pathway to get there. I don't expect anyone to just change that mindset, but I think it needs to be taught. It needs to be trained. It needs to have an opportunity for those who may not already are a strategic thinker, first of all, to have the opportunity to do this. I would say I challenge kind of the PMO or the project manager office organizations and the leaders of the organization to really provide the training, but also the opportunity and all the support to make sure that we think strategically, because that's how you evolve as a leader, whether you're a project manager or not. So that's really the challenge, a call to action. And I truly believe that people do want to make connections of what they do, how is it that is impacting anyone. So I do think people inherently want to know the impact that they leave behind when they successfully do something.
That's probably the clearest answer I've ever gotten to that question, by
Oh,
the way. What I like about it is that, yes, it is aspirational. No, nobody expects you to be doing it day one. It's a maturity model. You get there. And also some of the things that we're talking about, project managers are doing every day and not getting
yeah,
recognized
man.
for it, right? It's like, it's not that big of a leap when you stop thinking about project management as scope, schedule, budget, measurable dollar outcomes or, KPIs that are fundamentally not the KPIs, right? They're just like indicators, not outcomes. When you strip that all back, what are we doing? We're interfacing with humans. We're driving collaboration. We are aligning viewpoints. We are driving towards outcomes. So, even though it sounds like a big leap on paper, when you kind of frame it the way you have, you're like, yeah, no, it's just like the journey can continue up. If you feel like you can do it in your
Yeah.
sleep, yeah, you probably do need to
Yeah.
get challenged. And I think the path does go higher than what we think of. We're like, oh, senior project manager, I guess you've topped out, and then just make some lateral moves and that's your career. But actually there's an opportunity to, I think legacy is a strong word, but not too strong of a word when you're talking about projects that are
Mm.
transforming lives. And I think that's yeah, that's a
Yeah.
good
I
way
mean,
of putting it.
I would just challenge the project managers out there who might be listening. When you're done with a project, let's say you led an AI project in healthcare, do you ever go back to the end user that it was intended for and ask them, how did the technology work for you? How do you feel as far
Mm.
as trusting the technology? Do you feel like you have more time? Like asking these questions, you get that qualitative kind of feedback, but you also probably hear things like, I kind of love it, but I wish it can do X, Y, Z. So that's really where we need to make that connections to the human users of that. And I think that is really something we don't do very well in project management. We done awesome. We check off. I just led a successful project. And I don't know if we ever
Mhm.
go back and really have a conversation with those who are the recipient of these wonderful things that we built and explore other kind of improvement opportunities.
For me, like I'm very guilty of that. Like, and I came from an agency background, so it literally was that you roll off a project, it's done, you move on to the next one, you don't look back, you don't even have a chance to
Mm.
look back. And I know a lot of folks in my community will say that still. They'll be like, "But David, like I don't have a chance. Like they put me on another project. I'm not like part of this core team necessarily. I get moved around where I'm needed." But I also, it strikes me that like in the healthcare space, I mean, it's just so like visceral and real. Like you are impacting, the lives of patients, like real human lives. There is an opportunity, I think, in some cases at least, to revisit that and like iterate on, you know, a project as part of an
Mm.
initiative, right? It didn't end there, right? It kept going. We're still evaluating, right, the outcomes. And I guess, I mean, the other thing that strikes me is that I'm like, healthcare sounds cool. It sounds serious. It sounds like hard work. The stakes are very high. It's a very relatable lens to be like, how did that go for you? Like, you know, now we have this, whatever, you know, medical fall prevention device attached to you, or now that we've got, you know, the like sort of ambient listening, now that we've got, you know, these tools, like, how is this going for you? Because it matters in terms of the way we take care of populations. But then I guess the other side of me is like, I touched healthcare a little bit in my past, but like I'm talking like hospital websites, you know, not like clinical systems, not like actual sort of patient solutions. You know, I'm not a medical professional. I have had no training there. But for folks
Mm.
listening who find this interesting, maybe they're leading projects, but like in a different
Mhm.
industry, but they want to like actually make the shift into healthcare, either A, because, you know, they're mission aligned, or B, it just sounds really cool. For folks who are like looking to make a pivot into leading healthcare
Mhm.
projects, like what skills or knowledge should they be seeking out? Like, do they need to become doctors and
Mhm.
nurses? Where should they be focusing their training? Because I think the other thing you said there in there was like, yes, it's about getting the right training to be
Yeah,
successful.
that's a great question. And for everyone who listen, the big response or answer is no, absolutely no. You do not need to be a clinician of any sort to add value in any healthcare project. In fact, I think what is really needed is more people who have fresh perspectives in different industries to really cross pollinate and be able to not have healthcare be mystified and be siloed like it has been in the past. So, as far as what skills are needed, just merely being a project manager, you already set yourself up for success because when you get your project management professional or PMP certification or the like, you're actually being, asked to be able to lead project in any industry. So that's a given. The second is really
Mm,
about I
mhm,
really think about when I go back to the PMI next and the more that I referred to earlier is about influence people and having effective communications to effect change. And that requires leadership skills and that really apply to any all industry. I think there's an opportunity for younger cohorts to really take advantage of the AI and data literacy and fluency. Because everything we talk about AI really needs to start with the foundational data governance, data normalization, standardization, data integrity, you name it. You can just do a little Google search. So having the passion to learn more about data and AI or this data literacy in general is an awesome skill set. We need more people like that. And then I think that you
mm,
might need to be mindful of certain industry, and healthcare is one that is everyone knows is highly regulated, just like the financial or banking industry. Being exposed to learning about when I mentioned CMS earlier or the CDC, everyone have heard about HIPAA or the Federal, Drug Administration. I think get more immersed in what are some of the regulatory requirements that has come down that we all
mm,
need to be aware of. Even people who are clinicians are learning those regs as we speak. So don't feel like just because you're not a clinician, we are just interpreting it as quickly as the next person, regardless of our clinical background or not. In fact, like CMS 0057, which is the interoperability and prior authorization reg, the final rule was published, and a lot of it's technology. Like I am trying to understand the technology
mm,
lens of it. And I think lastly is having some sense of empathy. We all, and that shouldn't be hard at all. I think people get into healthcare is because you might have a personal story or you have a loved ones, whether that's your brother, your sister, your grandparents that have gone through the what I call the care journey and you didn't feel like it was
mm,
ideal. That is what drives you, and that's the intrinsic
mm.
motivation that feed the purpose, and that is the passion that comes through when you work with any project. Imagine that gets translated in the project that you are leading in healthcare. It will become evident that you listen for nuances and you care about who's actually delivering the care. So, what I think is empathy sometimes helps as well. And that has nothing to do with being a clinician. It helps you to be curious with a sense of humility and the ability to translate and make connections from a technologist, data science, to an infrastructure person, to a QA person, and ultimately the various clinicians. So, no, you do not. And we welcome, speaking on behalf of my other colleagues, to have like people who are engineers and financial people to really do a lot of what I call the QA to help us to make sure that we are leveraging the diversity of thoughts, but also skills.
I love that. I also love that it's like in finding that empathy, almost everyone has a story of going through some sort of healthcare journey themselves or their loved ones or someone they know. And then isn't it so human to be like, and this part of it could have been better? And anchoring around that to drive your curiosity to be like, you know what? I know some people in my life, who are very inspiring, who were, impacted in some way by some kind of, health event or health crisis, and have, taken up the mantle to learn, right? To be like, okay, well, I need to learn as much about this as I can, even if that means me reading medical
Mhm.
journals that I only kind of understand, and just like using the tools available to me to get smart about this. And the same could be true, pivoting into healthcare, where it's not like these answers are, you know, inscribed on some
Mhm.
scroll that's hidden in a temple far, far
Exactly.
away. Like this, like you can get at it. The HIPAA stuff, it's like, sure, it's going to be dense, it's going to be a challenge, but it's out there. And if you're committed to it, then, you're learning. And guess what? Everyone else is learning too. You're not necessarily that far behind. And it's those perspectives and that empathy that really kind of
Well
drives it through.
summarized, Galen.
I know we could go on for days. I do want to talk about, I'd love to have you back to talk about measurable
Outcomes,
health
yeah.
outcomes. Maybe to wrap it up, just for fun, do you have a question you want to
Oh
ask
my
me?
gosh, I was waiting for this opportunity because I want to learn from you too. I would say that, for someone who knows project management well and interact and learn from other project leaders week after week in different industries, I would say, what would be kind of the big trend out there or the shift in mindset or thinking when you're seeing like digital projects outside of healthcare? What can be taken from someone who is so deeply immersed in healthcare that is almost like project management lesson for a healthcare practitioner to learn from other industries?
That's a great question. I think it probably happens more in healthcare than
Mm,
I assume, but I would say like this sort of cross training, cross pollination between strange roles that don't necessarily talk to one another. So let me kind of zoom out from there. Like what we're finding, sometimes in a good way and sometimes in a bad way, but digital teams are expected to do more with less. I mean, maybe that's true across the board, but in other words, we see a lot of like role hybridization. You're responsible for this and this. You're a business analyst and you're a project manager, or you're an account manager and you're in business development. And so there's a sort of like collapsing. And then the other thing we're seeing is that we're like different roles are coming into the mix because, I'm dating back a ways, but, on a project I was working on a while back, like we were working with someone who was a linguist because we were doing natural language processing on, customer data and customer feedback. And it was just like these collisions of people who know different things and they don't look like they should fit together, but if everyone can kind of start seeing from their perspective and learning from one another, then it can like diversify the way we think of a team. And like I think that in any industry, we get like fixated on like what people do we need to do X or Y, and we're like, oh yeah, ABC. It's like always this team, but we can actually switch it up a lot more to get some of these different perspectives. We can like intentionally learn from one another, and then I think along the way, for better or for worse, I think we'll be able to do more than just one job, and that might be an asset, actually, in like the age of AI. Remains to be seen though, because right now it looks like cost cutting and like lean budgets and employers trying to get more from their talent. But I think there's an optimistic upside as well from all of this, which is I think it does sort of level us up and get us used to working with different people and getting us thinking about things a little
Oh,
bit
that
differently.
was very useful, Galen. Really. I'm on top of it, so I need to make sure I remember what you share because healthcare can benefit from implementing just that. Absolutely. I know we talk a lot. I hope that some of this answers some of your curiosity and others as well. But it's been a
Oh, absolutely.
delightful just share, bouncing back questions and answer responses. So I learned quite a bit in my listening to you.
Oh yeah, ditto here. This has been a really great conversation. Thank you again for your time. Just for folks who are listening, like where can people learn more
Yeah.
about you?
I'm relatively active on LinkedIn, so I really invite people to connect with me. And, for the last month or so, I've been inspired to write my LinkedIn blogs. And my blog is really around a handful of topics that I'm very passionate about to show kind of my multidimensional kind of authentic self. It's not just about healthcare and technology, which I'm deeply passionate about. It has taken me so many years of making sure that technology should enable, what the business user need. Like the strategy should not be driven by technology only. It should be driven by the business and the clinical leaders. The other thing I'm passionate about is I mentioned health equity a lot. It's not just because it's one of the 5 quintuple aims. Is obviously I'm an Asian person, not just an Asian leader or anything like that. Is I have my own personal experience with health, and I truly see it with my mom and my grandparents as far as how their care journeys is. So I think the discussion and the opportunities around health equity is important for me to highlight. You know that I'm a passionate advocate for project management in general. That's why I, definitely have volunteered for many years. But how do we bring the project management lens to everything? But is more strategic project management. And my nonprofit, there is a lot of synergies where I think is about giving back and putting it forward. It's not just bringing a team along, but how do you see the community? And the community can be defined as your local city or county, but sometimes our community is global in some ways. So I think all these are topics that I invite people to come read more about on my LinkedIn blog.
That's super cool. I like that the blog is where it kind of all
Yeah.
comes together. I'm super interested to tune in. I will include links to your LinkedIn and your blog when this goes live. I'm super excited. David,
My
thank you again.
pleasure. Thanks so much, Galen, for the conversation.